In response to a safety alert, Pan-Caribbean sugar has been recalled after lab tests confirmed contamination, metal fragments or so, metal pieces. Tracey-Ann Elliott is the interim CEO of the National Compliance and Regulatory Authority, and she's joining us this morning to explain the details of the recall and the steps being implemented to ensure products meet the necessary safety standards for consumers. Good morning, Tracy. How are you?
Good morning, Simone. I'm doing well. How are you?
Well, I'm very well, thank you. Harris is also here with me.
Hello, Delia.
Hi, how are you?
Tell us how this usually works now from the get. How is a recall usually triggered? Is it that somebody finds it, or is it that the company finds it and makes the recall? How does that work?
So once there is an alert in the public space, the NCRA, the National Compliance and Regulatory Authority, would undertake an investigation. And so information coming to us in April would have indicated that there was sugar that was contaminated with metal. The information came to us on the 9th of April, and on the 10th of April, we deployed our inspection team to enter into the domestic market to see, to collect samples and to do an evaluation of what exists in the market. Those samples are then brought back to the lab for testing. Concurrently, we would also have visited the factory to do our checks there, to do our inspection, do an assessment of the system, and to determine whether or not there is an issue at the factory. So that is the starting point.
Well, Tracy, before I get into anything else, I'm curious as to how this even happened. Are manufacturers expected to meet certain regulations? Are inspections done regularly? Like how could they be producing this and this would happen right here in Jamaica and go undetected for so long?
All right, so just a quick, I'm going to take us a little step back. So the National Compliance and Regulatory Authority, we operate 3 inspectorates, one of which is the Food Safety Inspectorate. And what we do is register food processing establishments. So we conduct inspection, we do sampling, and we monitor for compliance with the regulations, and we carry out enforcement actions as is required. And so the registration is done annually, and within that registration period, then we do periodic inspection to ensure that the systems are in place. We look at the surfaces where we have food exposed. We also look at records to ensure that the records are in order for us to issue that registration certificate. So the NCRA does inspections at the point of registration as well as during the period of registration.
All right, so what were the specific contaminants found in the sugar, and how widespread was the contamination?
Well, at this time, the preliminary results coming from the factory would have indicated metal fragments. And based on the fact that you were able to use a magnet to separate some of the metals, we concluded that there was some ferrous material within those metal fragments. Coming out of that, we would have done a wide market surveillance, just to collect samples. Up until the 24th of April, we collected 47 samples. We had those tested, and about 33% out of that had metal fragments. Over the weekend, Saturday and Sunday, just this weekend, we sent the team out and we collected an additional 117 samples just to ensure, get an appreciation as to the extent of the contamination. Those results are not fully yet in, but based on what we have so far and the contamination that we discovered at the factory, we would have issued this recall notice, and we would have also indicated to the factory that there are some corrective actions that needs to be put in place in order for the products that they have to come out from detention, because they're currently being detained, as well as to ensure that the population is safe.
So you are now, or you have issued a recall for a certain batch code.
So we have issued, at this point in time, we have issued a recall for
everything.
all Pan-Caribbean Sugar Company products.
So how do we move now to the next steps to get the products back on the shelves? What does Pan-Caribbean now need to do? What does that process look like? I'm assuming it's a multi-step. Well, I know it's a multi-step. To get it back on the shelf now so consumers can know, okay, it's safe again.
All right. So our regulations allows that once there is a non-compliance that is identified, then the manufacturer can do some rehabilitation to ensure that the sugar or that the product is safe for human consumption. At this point in time, we would have stipulated a number of areas that are concerning at the factory. And so we asked the factory we directed the factory to conduct an assessment to determine, first and foremost, where the issue came from and how they were able to address it. Once these are communicated, this information comes back to the authority, then we do an assessment. We also do periodic evaluation to determine the effectiveness of the corrective actions that they are undertaking. And so on yesterday, the 27th, we would have visited the factory to have a look at some of the corrective actions that they have put in place and to determine how effective they are.
We're going to talk about the consumer first, and before I even do that, I would just want to congratulate the consumer who was vigilant enough to say, listen, something doesn't look right to me, and I'm going to do my own self-test just to make sure, and then to raise public awareness.
Is that how it happened?
That's the part that I saw. I don't know, that's the part that I saw.
Okay.
And to me, people have a way of being nonchalant and saying, I'm not going to drink this and just toss it away.
Yep.
But the fact that, they pursued it is very commendable. But for other consumers who have heard that there's a recall, how do I identify what's been recalled and what's not? So if I purchase, I can say, oh no, this is a batch I shouldn't be having.
At this time, there is a recall for all products, all Pan-Caribbean sugar products.
Okay.
Until the demand is satisfied from your end, that they've met all the protocols, all the procedures to rehabilitate and to remediate this, then it won't go back on the shelf until that's done.
That is correct. Until we are satisfied that whatever resides within the sugar has been removed and that the consuming public will be safe.
So when you find out, you said you've dispatched folks to go. I guess you go and check the line to see what happened in the process of manufacturing. Will the public be made aware of how, as Harris asked you earlier, this was able to happen?
Well, at this point in time, the NCRA would not necessarily be able to point out where things went wrong or how it went wrong. What we have looked at are the documents, the records of our inspections, which would have indicated that nothing was out of compliance. Our last inspection was conducted in January of this year, and there are records of calibration of equipment, records of preventative maintenance of equipment were all in place. So we would not be readily able to identify, but what we would direct the company to do is to do their checks. And of course, there are other agencies who would also be a part of the process who would be doing the checking as well.
What message do you have for consumers regarding the safety and quality of products that are on the market? This one's been, identified and it's being resolved, but for everyday use, what message would you give to consumers?
Well, the National Compliance and Regulatory Authority exists to ensure that our people are protected. We do have a mandate to ensure that we create confidence in consumers and products with mandatory standards. We monitor for compliance and we provide assurance to the consumer that health, safety, and there's fairness in trade. The NCRA, we monitor quite a number of food processing facilities. We ensure that the product lines are safe, that the spaces where food is stored, that it's safe. If there are certain baits that need to be set in spaces to ensure that there's no rodent coming into the spaces where food is produced. We ensure that those are safe. But what we also say to consumers is be on the lookout, and if there's any occasion or any identification of non-compliance, non-conformities, anything that you are concerned with, there are agencies that you can reach out to. Certainly, we have the Consumer Affairs Commission that you can reach out to. And of course, we have the NCRA, who you can talk to. Our inspectors are always on the ground, always out in the field, always ensuring, asking questions. You can ask them questions. If you're not certain about something, ask the questions. And if there's an investigation that needs to be done, the NCRA stands ready to do the investigation, because our mandate is to ensure that the public is safe.
My final question, Tracey-Ann, is for those consumers who may have consumed it. When I read the release, it was saying, something like this can give you gastrointestinal injury. You might have missed dental damage if you haven't had it yet and you haven't consumed it. But if I've consumed it, what do I do? If I feel as if, it's affected me in some way, are there advisories to the public in terms of, do they go to a clinic? Do they go to the doctor? What do I do?
Well, certainly that would, you hit the nail on the head. That would fall within the remit of the Ministry of Health and Wellness. And certainly we would say that if you have concerns about the health implications, we ask that you just reach out to your healthcare provider and provide the information to them. And certainly you'll get that sort of feedback from your healthcare practitioner.
Okay. My final question to you, Tracey, it loops back to when I'd asked before. I know that the NCRA has done its independent investigations. I know you guys go in on an intermittent basis at certain intervals to make sure you check. What I'm asking is, based on what comes out of what you asked Pan-Caribbean to do, the investigations you've asked them to do, will the public be allowed access to the explanation based on what you find as to what happened to close the loop of the recall? Will we know what happened?
Well, certainly there are a number of agencies that are collaborating on this particular issue. And once we have the relevant investigative report, then those agencies will meet and relevant information will be released to the public, because as we are here to ensure that the public is aware of what is happening, aware of what are some of the things that they need to look for, and aware of who they need to communicate with in the event that there are certain situations that they find or that arise in the public space.
Excellent.
Thank you so much, Tracey, for taking the time to update us on what's happening, and we look forward to receiving more information, right? Thank you so much.
Thank you. It was my pleasure.
Yes. Interim CEO, Junks. Go on, Harris.
Of the National Compliance and Regulatory Authority, Tracey-Ann Elliott. After the break,
Dr. Nastasia Tate tells us how she's redefining women's health care. We'll be right back. We don't know who to talk about.